Hi, this is Mrs. Lewicki, and this is the first of our PowerPoints on the concept of evidence-based practice. We use evidence-based practice. It's another word for saying science, that there is a science that backs what we're doing. It's the best evidence from the most current research. It includes the nurse's, oops, that was not a good move, nurse's clinical expertise, and can include client preferences. Through integration of components in decision making, what evidence-based practice allows us to do is we can individualize client care, and nurses can provide best practice for client-centered care. And as anything that's science-based, what we know is that it's true for about 80% of the population, and that's what makes it evidence-based. According to Sigma Theta Tau, evidence-based nursing is an integration of the best evidence available, nursing expertise, and the values and preferences of the individuals, families, and communities who are served. The evidence-based practice and the use of it in healthcare has evolved. In 2002, there was a landmark study out by the Institute of Medicine, and it said to err is human. And basically what they were looking at is all the gaps that existed in our healthcare system. There's been additional research since that time, but there were a large number of deaths associated with human error. And so the purpose of this report was to institute strategies for improving the healthcare delivery system and make it less punitive and more where are the gaps in the system and see where those problems were. Nurses use evidence-based practice when they collaborate with other disciplines, when they assist clients through system in a variety of roles. They ensure quality communication and continuity. And by using evidence-based practice, it helps to improve patient care and patient outcomes. They access a variety of sources to guide practice and improve care. That it ensures credibility of the nursing profession. We don't want to just do things just because we think that it's right. We need to be, or it feels right, we need to be doing things, as many as we can, that are based in evidence. It provides accountability for nursing care, and Florence Nightingale was actually one of the first that used evidence-based practice, but we didn't call it then. She was one of the first to recognize that we needed to wash our hands when performing care. Nursing clinical research. Nursing research helps to test hypotheses about conditions and processes. It seeks answers to improve patient care and patient outcomes. Quantitative research is when I'm looking at a specific thing and I'm trying to measure, can I improve the temperature, let's say, or the heart rate of patients, and I have actual data that I measure for that. Qualitative research is more about how does it make the person feel. So did they get pain improvement with the implementation of this new procedure? That would be qualitative research. Participants, there's a list of criteria before somebody participates in a research project. Age, weight, gender, medical history. Those are all data that's collected and can exclude patients from participating, individuals from participating. The type and the current stage of their disease process may include them or exclude them, and any recent medications taken and current medications. Research participant, they do seek volunteers. They have to meet all inclusion criteria. They have to be informed and have, of all aspects of the study, they have to have an assigned consent, and they do have the option of opting out of a study at any time. We always want to make sure if we're doing research that we have respect for the human dignity, that we use beneficence, that means we're trying to do good, and justice when we're practicing within a research project. Again, it needs to be an informed consent, the right to receive full disclosure and information regarding the study, and the right to withdraw from the study at any time.